Hello everyone, welcome to 5 Mark Short Note series. In this video, we will discuss about Galactorrhea. So, Galactorrhea is inappropriate milk secretion in non-pregnant, non-lactating women. It reflects an underlying hormonal imbalance, especially hyperprolactinemia. First, we need to understand the physiology of lactation. What is the role of prolactin? Prolactin is produced by lactotroph cells in anterior pituitary. Its primary function is to stimulate milk production in the mammary gland. During pregnancy and lactation, prolactin levels naturally rise. And next is dopamine inhibition. Dopamine produced in the hypothalamus normally act as a brake on prolactin. So it travels down to the hypophyseal portal circulation and suppresses the prolactin secretion. So anything that reduces dopamine or blocks its action results in increase in prolactin. And the role of other hormones like estrogen, which increases the prolactin gene expression, thyrotrophin releasing hormone that stimulates the prolactin release, and stress and sleep increases transient prolactin levels. Prolactin stimulates milk production, dopamine inhibits prolactin, and whenever there is a disruption here, this results in galactorrhea. So the causes include it can be at the level of pituitary, endocrine, drug-induced, or physiological, or sometimes maybe idiopathic. Prolactinomas, that is microadenoma and macroadenoma. In case of microadenoma, it is less than 10 millimeter, macroadenoma more than 1 centimeter. Other tumors like non-functioning adenomas, craniopharyngiomas compressing the pituitary stalk. Then stalk effect. Compression reduces the dopamine inhibition and mild prolactin elevation. Hypothalamic lesions, infections, trauma, and infiltrative diseases. Coming to endocrine or systemic causes, hypothyroidism. High TRH drives prolactin secretion. Chronic renal failure, there will be impaired prolactin clearance. In case of cirrhosis, there will be altered hormone metabolism. And chest wall lesions like burns, herpes zoster, trauma triggering neural reflex arcs. Coming to the drug-induced galactorrhea, it is very common. So antipsychotics like risperidone, haloperidol, and antidepressants like SSRIs or TCAs, GI prokinetics like metoclopramide, domperidone, antihypertensives like methyldopa or verapamil, estrogen-containing oral contraceptives, opiates, then dopamine antagonism or increased prolactin synthesis. Rest, sleep changes, sexual stimulation, postpartum state, and idiopathic causes like heightened prolactin sensitivity. Coming to the clinical features. Milky discharge, which is bilateral, often expressible, non-bloody, that is bloody suggests other pathology. Then menstrual and reproductive one. Hyperprolactinemia suppresses gonadotrophin releasing hormone, which results in reduced LH or FSH, amenorrhea, oligomenorrhea, infertility, anovulation. In case of neurological, there could be headache or visual field defects in macroadenoma because of compression. There will be hypothyroidism features like weight gain, lethargy, cold intolerance. In case of men, there will be loss of libido, erectile dysfunction, and gynecomastia. So the diagnostic workup include first to check the possibility of pregnancy and menstrual cycle disturbances, medication history, symptoms of hypothyroidism, renal diseases, and visual symptoms like macroadenoma. Coming to physical examination, examination of breast when there is any characteristic discharge, palpation of thyroid, and visual field testing has to be done. Coming to the investigations. So first do a pregnancy test and then check for serum prolactin where mild elevation will be due to drugs or hypothyroidism. In case of high elevation, suspect prolactinoma, do a thyroid function test and free thyroid T4, renal and liver function test. So MRI pituitary can be done to which determines the tumor size as well as stalk compression and infiltration and visual field perimetry for macroadenoma. Coming to the management, so avoid nipple manipulation, stop causative topical agents, then treat the underlying cause, so hypothyroidism, then suggest levothyroxine, drug-related discontinue or switch over, chest wall lesions, treat the primary cause, renal disease, address the renal dysfunction. And for dopamine agonist, the mainstay include cabergoline, which is preferred, long-acting, fewer side effects, then bromocriptine, which is safe in pregnancy. So its effect include lowers the prolactin, shrinks prolactinomas, and restore ovulation, menstruation, and fertility. Bromocriptine. So surgery is indicated only when there is drug intolerance, macroadenoma with progressive visual loss, due to mechanical pushing, lack of response to medical therapy. So the procedure is transsphenoidal adenoma excision and radiation therapy used rarely for resistant tumors. So coming to the complications, it leads to infertility, osteoporosis from hypoestrogenism, visual field defects, psychological distress, pregnancy complication from untreated pituitary tumors. To summarize, it is inappropriate secretion of milk from the breast of women. Galactorrhea reflects the underlying hormonal imbalance caused by the excess prolactin, and this when the woman is neither pregnant nor breastfeeding. So the disturbance may arise from prolactinoma, hypothyroidism, renal failure, and chest wall stimulation from pituitary tumors, and sometimes use of drugs like antipsychotics, antidepressants, and metoclopramide. Women typically present with milky nipple discharge along with menstrual disturbances, infertility, headaches, or visual symptoms when pituitary mass is involved. So diagnosis begins with ruling out pregnancy, followed by testing of serum prolactin, thyroid function, and imaging the pituitary with MRI is suggested. Treatment focus on correcting the cause with dopamine agonist like carbapenem forming the mainstay, and surgery reserved for only resistant tumors. Early identification and management ensures good outcomes, restored fertility, and prevention of complications. I hope you have learnt from this video series. Thank you very much for watching the video.